Hello, good afternoon, and welcome to Toronto Rehab's Blakely Health Innovation webinar this afternoon. My name is Cindy Yelle, and I have the privilege of serving as President and CEO of the Toronto Rehab Foundation. I should tell you that we are beaming to you live, and I should tell you where we're at right now. We're at a small studio on the main floor of the Toronto General Hospital. And Toronto Rehab is a member of the University Health Network, UHN family. And within that UHN family is Toronto Rehab, clearly, Toronto General Hospital, Toronto Western Hospital, and Princess Margaret Cancer Centre. So it's quite a collection of very powerful hospitals that are really making a difference. So we are on Discovery District, and some of you may have heard about Discovery District in the past. It's one of the world's leading concentrations of science and researchers dedicated to advancing healthcare for our community, not just in Toronto, but across Canada and around the world. And it's a small stretch of University Avenue from the south at Dundas up to College Street, including the University of Toronto. So we really are living in Toronto. I think most of the people beaming or tuning into us today are from Toronto. I understand there may be some across the country, and in fact, in the States as well. But right here in Toronto, we really are very fortunate to have, like I said, this concentration of extraordinary science taking place to help advance kind of healthcare today and tomorrow. So we've done a number of these webinars in the past over the last couple of years, and they've gained more and more interest and attention as we've moved forward with them. I understand we have hundreds of people potentially listening to us today. The session's intended to be interactive. So a short introduction by me. I will be passing the mic, so to speak, and the floor to a colleague of mine, Dr. Jaan Reitav, in a few moments. So on the interactive part, Jaan's going to be presenting for about 25 minutes, 30 minutes. At that time, we'll take questions from the floor, from the audience, and like I said, intended to be very interactive. Don't wait to ask your questions, but rather send them along as they come to mind, and we will take them. Hopefully we'll get through all of them today. Really important that I do a shout out and acknowledgement to our sponsors today. Liquorland Capital, and this is an organization that's led by the former chair of the board of Toronto Rehab Foundation. His name is Bob Blakely. And in fact, we renamed this webinar, these health innovation sessions, in honor of Bob. Hence they carry the Blakely name, the Blakely Health Innovation webinars and series. We have FAF as a sponsor. Thank you, FAF. Neinstein Lawyers, Functionability, and Torkin Mains Barristers and Solicitors. So these sponsors actually make it possible for us to film and beam out to all of you. One more thing before I pass the floor or the mic. I wanted to or share with you a little bit of information about Toronto Rehab. We are Canada's leading rehabilitation centre and hospital dedicated to post-acute care. So focused on adults that have been through some really tough times, whether it's cardiovascular disease, stroke, brain injury, spinal cord injury, and the list goes on. Our hope is to help through our clinicians and our scientists too, working together, help these individuals get back to living their lives, get back to their normal, whatever their normal may look like. Get back to their homes, get back to their families, get back to their jobs. Like I said, get back to living their lives. So today's session is called Why Sleep Matters. And last night I slept like a baby. I had like 8 hours sleep, which is unheard of. And I'll tell you, when I say sleep like a baby, I truly feel like I'm a little bit reborn today. I'm looking at Dr. Reitav as I say that. Sleep's critical, not just to feeling decent at work and with your family and just in your daily interactions. But there are a lot of health conditions that are impacted by quality of sleep, frequency of sleep, duration of sleep, quality, like I said, quality of sleep, diabetes, cardiovascular disease, stroke, and the list goes on. So today's session, again, we're really on the health prevention platform these days. We want to give you tips and tools that you can take away into your own life to help you kind of, in this case, sleep a little bit better, feel a little bit better, be a little bit more productive. So on that note, I am going to introduce my good friend and colleague, Dr. Jaan Reitav. Dr. Reitav is a clinical and health psychologist with over 30 years, how is that possible? 30 years experience, over 30 years experience, and a professor at the Canadian Memorial Chiropractic College in the Faculty of Clinical Diagnosis. He's a certified behavioral sleep medicine professional from the American Academy of Sleep Medicine. And at Toronto Rehab, he's a staff psychologist with the Cardiac Rehab program. Jaan, you've developed neurorelaxation, quote unquote, neurorelaxation, which is an innovative treatment to help patients with chronic sleep and health problems reduce stress and improve sleep-wake rhythms. So on that note, the questions, before I pass to you, the questions, please send them to us during Jaan's presentation when they come up. We will get to them in about half an hour. And where you send them is on the screen in front of me, I guess on the screen behind me as well, trf@uhn.ca. Again, trf@uhn.ca. And we'll get to your questions hopefully a little bit later. So on that note, Jaan, would you like to join me up here?
Absolutely. So thank you, Cindy, for the invitation. And I must say it's been a pleasure working at Toronto Rehab, where I've been for the last 13 years, working with cardiac patients, diabetics, stroke patients, and cancer patients. And across those years, one of the things that I think is important to get across to patients is the importance of sleep. And what I found is that many of the patients who show up at our center have been going through some really difficult periods. And of course, when they arrive, they are quite stressed, and it's fairly common for people to have sleep issues. So across the time that I have been there, I've been really very interested in helping them in improving their sleep patterns. And so we're going to talk a little bit about sleep and why it matters. And starting with this quote, which is really underlining that sleep as a pillar of healthy lifestyle is just as important as diet and exercise. And I know in the last Blakely Health Innovation Seminar, Dr. Alter talked about exercise, so I'm going to tell you why sleep matters. Now, there's been quite a bit in the media and quite a bit of attention paid to sleep. So recently, Dr. Michael Bruce published a book, The Power of When, which is about circadian rhythms and the fact that across the 24-hour day, there are different times when we are at our peaks for physical energy, for cognitive ability, and so forth. So it's certainly one of the things that's been out there in the public eye. More importantly, those of you who are joining us at lunch at your workplace, I would highlight a book by Adriana Huffington, an executive, a very, very influential woman, and somebody who's very, very keen on health and wellness. And she wrote a book called The Sleep Revolution and described her own personal experience. So she had been really working very, very diligently at building her career and really ignoring sleep. And she describes how she actually collapsed at the office, and that was a wake-up call for her that, you know what, I think we better pay more attention to sleep, and it really does make a difference, not only in terms of our physical health, but also our cognitive health. And I would also recommend, last month, the National Geographic had a cover story on the science of sleep, very well written, and it is available online for free. And if any of you want a copy of that, we can send a link out to you if you ask for that. So very, very in the public eye, and something that we all are tuning into. Now, why should you care? So I'm going to make two arguments. One is more for employers, and one is more for employees. The employers should know that when your employees show up sleep deprived and struggling with their sleep patterns, they're going to make mistakes. They're not going to be as efficient. And a study just published earlier this year on the costs of poor sleep in Australia estimated that the indirect and direct costs of sleeplessness among the Australian population cost their economy about 45 billion, that's billion with a B, dollars. And those costs are reflected in many, many things, and we all know that things like the Exxon Valdez disaster and the Challenger disaster, all of these huge things that come up once in a while are huge events and impact all our lives. And so it pays to make sure that we all attend to sleep. And I'm going to talk about what good sleep is, and I hope to give you all some specific ideas about what you can do to manage your sleep better. So I'm going to start with this slide, and what you see on the bottom of the slide is the sleep pattern that we all come into the world with. So as you see, sort of from left to right, you see blocks of sleep, which are sort of the black color, and then periods of wakefulness. So this is, I would call, the default pattern that all of our sleep is really based on. And as you can see, it's disorganized, and there is no sense that there is a kind of awareness of any 24-hour period of day and night. And in fact, as you kind of go up level by level, you see that the one-year-old toddler is doing quite a bit better. By then, most children have learned to sleep mostly through the night, but most of them can't make it all the way through the day without naps. And that continues for a period of about 4 or 5 years. It's really until our kids are about ready for going to school that they're finally able to manage to get enough sleep in the nighttime that they can make it through the whole day and study and do all the things that we expect all kids to be able to do. So what emerges from this slide is the idea that although we're born with a particular pattern of sleep that is quite independent of the day-night cycle, that it in fact develops across the pattern that we look to as good sleep and normal sleep in adults is something that we develop through a lot of training, a lot of practice. And usually this means parents who are willing to set very clear routines for babies where you might do a bath, and then you might play for a bit, and then you might read a story, and then you sing a lullaby and put the baby to sleep. And so that kind of a preparation for sleep is really essential to kind of get kids to kind of calm down and be able to get to sleep and then sleep through the night. So that's kind of the pattern as we know it. And it's demonstrated in, and it sort of has evolved into, an understanding that there are two basic processes which will get us to sleep. So one of them is, we'll call it the biological need for sleep, and it basically works on the basis of how long you've been up. So as you see on this diagram here, there is a S labeled, and as the time of day goes from left to right, you'll see that the S sleep drive is accumulating, and it keeps going up higher and higher. And that's based on the fact that you're active, you're doing things, you're using energy. When you use energy, you're depleting your muscles of that battery charge, that energy. And so you need to get a rest. You need to get sleep in order to recharge those batteries. So that's the S drive. And then there is the circadian sleep drive. And that's the one that we have to entrain. We're not born with it. That comes from practice and repetition. And you can see on the diagram here that there is a letter C, which stands for the circadian rhythm. And you'll see that as the day progresses, the circadian rhythm actually makes us be alert and aware of our environments, and kind of depletes the pressure to sleep. And going from left to right, the sleep pressure represents the pink area in these diagrams, and the pink area is the amount of sleep pressure that you feel at any one point. So as you go through the day from 7 in the morning till 11 or 23 at night, you see that that vertical bar between those two graphs gets longer, and it reaches its highest point around the time that you get sleepy and want to go to sleep. And this cycle recurs the next day, and you'll see in the purple area that when you do sleep and you actually get rest, that sleep drive comes down very quickly. And the next morning when you get up again, the sleep drive begins at a much lower level and continues up. Now, for those of you who remember pulling all-nighters at university, you can relate better to the graph on the lower panel, which is where someone has stayed up for 2 days straight. And what you see is that sleep drive, the biological sleep drive, has continued to go up across the 2 days. It does reduce a little bit in the second day because the circadian rhythm, again, reduces the amplitude of that sleep drive. But this is basically the way in which our sleep-wake cycles are organized, that it's the combination of a well-trained circadian pattern in combination with the biological need to recharge our batteries. Those two together that creates what we would call a healthy sleep pattern. And while I'm at it, I should mention that this is one of the things that, or one of the events that happened in the last year was that the Nobel Prize for Physiology and Medicine was won by 3 researchers who basically did the work to explain how our bodies know about the circadian rhythm and how that circadian rhythm works. And what they in fact discovered is that every single cell in your body has a bull of a watch in it, and it works with proteins so that proteins are released from the nucleus, they travel out to the protoplasm, they unite there, they come back into the nucleus, back to where they started, and that cycle takes exactly 24 hours. So every cell in the body knows how to keep track of time. What it does not know is it daytime or nighttime? So where are we in that 24-hour cycle that is important for us to adapt to our environment? And the key piece to that entrainment is what's called the suprachiasmatic nucleus. So we respond to light. So in the morning when you wake up, you get out of bed and you look out and the sun is in the sky, that sunlight is what tells the brain it is morning and we're starting our activity now. And then as you progress through the day, all of the other organ systems of the body kind of figure out where they should be in terms of what their jobs are and integrate with that central timekeeper. So most of us don't know what happens when we sleep. Basically, when we sleep, we're out. We're not conscious of anything, and so it's hard to know what value sleep has. I think it was Thomas Edison that felt that sleep was a really bad habit, and he imagined that one day none of us would need any sleep at all. But in fact, it turns out that not only is sleep essential for recharging your batteries and getting your energy back for the day, but it's also critical for your brain and mind in order to function normally and for your executive abilities of problem solving, memory, all of those things happen because during the nighttime, your brain reorganizes itself in very important ways. Now, if any of you do one day go to a sleep lab for a sleep test, this is what you would be doing. You'd be lying in bed and they wire you up so that they collect information on what your brain is doing and what your body is doing across the whole night. And what you in fact see is that the brain goes through a whole series of different states which are quite magical in sense of that they're organized to allow the brain to get ready for the next day and start the day fresh with a new memory system. So what you can see here is there's different levels of sleep: light sleep, medium sleep, deep sleep, and then REM sleep or dreaming sleep. And you can plot this on a chart where you look at from the time the person comes into the sleep lab on the left side all the way across the night of sleep. You can see what's going on in terms of their brain activity. And what you see is it goes from being awake into a mild, a deep sleep, and then from there into REM sleep. And those stages are really, really important because they allow the body to recover and to rebuild itself in order for it to face the next day. Very important in that is what happens in the very first the very first non-REM or deep sleep period. So this is on this diagram stage 3 and 4. And in that stage, you'll see you're in what's called slow wave sleep, highlighted in the green on the slide. And it is a very important stage of sleep. Once you enter into slow wave sleep, your body releases growth hormone. And the release of growth hormone into the body travels around to cells that need repair or maintenance, or when you're young, it helps the young child to grow, and it's activated by sleep in the first 90 minutes. You'll see that most of your deep sleep is happening in the first 3 or 4 hours of sleep, the first half. And most of your rapid eye movement or dreaming sleep happens in the second half of the night. And during the rapid eye movement sleep, what happens is your brain is reorganizing your long-term memory system. So it is taking all of the things that you did from yesterday, all of the important things that you learned, and the short-term memory system, or the hippocampus, replays those things so that the slow learner, your long-term memory, can figure out how does this new stuff fit in with the stuff that it already knows. And all of that is happening during rapid eye movement sleep. Whether or not you waken and have a dream or not, it's happening for you. So it ends up that sleep is critical for the regulation of your cognitive functions, for memory, for problem solving, for attention, paying attention to what's going on. All of those things benefit from a good night of sleep. And most of that cognitive benefit is happening in the last half of sleep. Now, what happens when you have poor sleep? What is it that begins to happen sort of slowly, and what begins to happen in the longer term? So, and poor sleep can happen on any sort of given night. I think all of us have probably had a night or many nights where, you know, things have happened, we've been stressed, it's been really a difficult day, and then we have poor sleep. So what you're aware of is the next day there's a number of effects on both the mind and the emotions and the body. And in terms of your emotions, what most people will be aware of is that they feel a little bit more irritable, they may have a little bit more moodiness, or they may notice they just feel more anxious or edgy. In terms of your cognitive functions, you may notice that you space out a little bit, that you kind of just lose attention or forget what you were doing. And when that sort of sleeplessness continues for longer, those kinds of problems can continue or get even worse. More importantly, for your body, sleep is the time that your immune system is rebuilding itself. And the immune system is really what protects your body from illness and disease. So if your sleep is terrible across time, you're going to be more vulnerable to many, many difficulties, including cancer and other issues like that. Your risk for diabetes, for obesity, all of those things are increased, and of course, heart disease and stroke. So all of these things are gradually going to increase in terms of the risk that you are running So all of you out there that are in your 20s or 30s and fairly young, you probably figure, well, I can usually manage even an all-nighter or a few nights of poor sleep, and it won't really get to your health right away. But across the decades, you're running down your ability to function in a healthy way. And so we now understand that sleep affects many different processes, physiological processes that the body has to engage in order to remain healthy. One of the important ones is inflammation. So as you are active across the day and do various things, the body's inflammatory processes kind of build up. And when you go to sleep, your body and your brain kind of begin to metabolize those and allow those things to kind of reset so that you start the next day not in that kind of inflammatory condition. The other thing that's very important in terms of what happens during sleep is that basic metabolic activity is set or reset. So if you're not sleeping well, you're going to find that you're hungrier. You're going to find that you just want to snack. And they've found that in studies with people where they're sleep deprived for a period of a week or so, that gradually they start to take on more calories, in part because they're feeling tired, and so they take on and eat sugary things in order to keep themselves more focused. So those are the mechanisms on the left side. They're all impacted by poor sleep. And then in turn, across time, so we're talking now across years, that it's going to result in problems with your blood pressure, problems with weight gain, problems with blood sugars, and even cholesterol levels. And of course, across a decade, 2 decades, 3 decades, you begin to see the outcomes of problems with your health, with some of the major health issues that we're facing. So what I want to do and what I want to underline for all of you is that you can do something about this. This is not something that you have to deal with or have to endure. And I'm going to talk to you about a fairly simple way of understanding what good sleep is and what you should be aiming to do in terms of your sleep. And this comes from the work of Drs. Harvey and Busey, and they talked about sleep health framework. And that sleep health framework is basically 6 things that you can track for yourself, 6 things that you can do a better job of managing. So the first of these is regular sleep time. And by that, they mean, you know, if you get 7 hours of sleep every night, but one night you're going to sleep at 9 in the evening and the next night at 2 in the morning, okay, that's not a regular pattern. It's shifting back and forth. And so the brain likes predictability, and it can synchronize all of the physiological things that it has to do for you during sleep if you have a regular sleep pattern. So I'll talk about what you can do for that at the end of the talk. The other 5 things include the sense that your sleep is satisfying. And it's important also to feel alert during the day. We can talk about ways that those things can be accomplished. The next thing is the timing of sleep itself, that really the midpoint of your sleep pattern should occur somewhere between 2 and 4 a.m. That's when it is the darkest, and that's how we're synchronized to the day-night cycle in the most effective way. So if you're up till 3 in the morning and then get 7 hours till 10, you're sleeping into the morning, into the light. Sleep efficiency refers to how much of your time in bed you're actually asleep versus how much you are up and staring at the ceiling. And the duration is how long you should be sleeping. And the American Academy of Sleep Medicine has recommended all adults between 18 and 65 should be getting 7 hours or more of sleep every night. So I'll return to those at the end of the talk, but I want to just quickly run through what you can do. So if you're struggling with sleep, or if it's one of the things that has been difficult or has eluded you, there are some important things to kind of bear in mind. So in terms of waking up in the morning, this is where many people with insomnia struggle. And so Dr. Harvey has recommended the acronym of RISE UP, of what you want to do. So you definitely want to get out of bed. So, you know, find an anchor time, keep to it. Use the same time, and if you can, or if you need to, move around a little bit, wash your face, take a shower, whatever you need to kind of just feel your body going, and get some sunshine. Sunshine is the most powerful tool to reset our biological clock, that circadian rhythm that I was talking to you about. Listening to music or talking to a friend, all of those things are strategies that can work really well for many people, and I highly recommend them. And if you're a normal sleeper, you're going to find that even in the middle of the afternoon, as good as your sleep might be, that you go through a kind of a lull. In this graph here, it's represented by that sleep urge that does increase, usually around 2 to 4 in the afternoon. And so at that point, if you want to get out and walk a little bit or do something that engages you a little bit more, it can be really helpful because it's only temporary. It will be over quickly enough, and then you kind of get a second wind, as it were, and make it through the day. The more difficult thing for most people, certainly the patients that I talk to, is settling down at night and getting back to sleep. In today's world with internet and smartphones and all the different activities that we get involved in, it's hard to let go of those things. It's hard to not send out one more text or email. And so what's important is to kind of establish for yourself an effective wind down time. So, and the wind down is taking a little bit of time, sort of 30 minutes or plus or minus, where you can kind of figure out what you can do that helps you in calming down. Really, at the end of the day, what you want to do is to let go of all of your activities. So it's kind of counter to what we really live and breathe. We choose things that we love to do and we want to do them, and so at the end of the day, to have to say we have to let go of them is hard for many of us. Turning down the lights, because darkness is one of the things that triggers the body's release of melatonin. And melatonin is sometimes called the darkness hormone, and it is one of the things that it doesn't put us to sleep. It's not really a sleeping pill or sleeping substance, but it's a messenger, and it tells the body we're slowing metabolism down, we're going to rest. Keeping your environment calm, cool, a little bit cooler than you have the house during the rest of the day. And being able to do things that boost your parasympathetic system or your rest and your restore system, which is maybe doing some breathing exercises or meditation or yoga or things like that, can be very helpful. Now, what this slide shows is that as we go through life, children in the top panel, young adults in the middle, elderly in the bottom, that our sleep patterns begin to fall apart to some degree. But older people still should be able to sleep 7 hours or more and get the appropriate amount of REM sleep, and non-REM sleep begins to get a little bit lighter, but it's there for most people. And the problem comes in, and I'll finish up by talking about 2 of the common sleep disturbances, and then we'll get to taking some questions. So insomnia and sleep apnea are 2 of the things that I would want you to know a little bit about. So the first of these is insomnia. And what you have on the screen is the conclusion reached by Maria Basta and her colleagues at Penn State. And what she found when she looked at what insomnia is, it's not just a lack of sleep. Many people feel, oh, I'm not sleeping well, you know, I've got to change my behavior a little bit. In fact, what she found is that everything in terms of how your body is functioning shifts into what is called a state of hyperarousal. So that's the sympathetic nervous system, or the gas pedal in the body, is going crazy. It's not letting up. And so she said insomnia is not a state of sleep loss, but a disorder of hyperarousal present both during the night and the daytime. And many patients with insomnia will tell me that they can't fall asleep. They can't sleep at night, but in the daytime they can't nap either. So that's what hyper arousal does. And she says the therapeutic approach should target your autonomic system, and that's in fact what we've done at Toronto Rehab with our cardiac patients. And what you see in the insomniac patient is you get a lot of awakenings through the night. You'll see through the middle part of the night 2, 3, 4 awakenings, very little deep sleep and less rapid eye movement sleep. And of course that has implications for your health. The final condition that I want to go over with you is sleep apnea. And sleep apnea is a growing problem, especially among baby boomers and people that are a little bit older or let's say more experienced in life. And what happens is, and you may or may not have noticed this if you're a little bit older, but your body becomes a little bit flabbier, right? And so that's not just generally skin or muscles, it's also in the throat and the upper airway. And there's an area up here called the pharynx, which is a soft, fleshy tube, and it's prone to collapsing. As we get older, it will close. And when it closes, then you aren't able to get oxygen to your lungs. When the lungs don't get oxygen, they freak out. They tell the brain, we're going to die in 5 minutes, and the brain turns on your stress system to wake you up and breathe, right? So it won't let you die. But what happens in the meanwhile is that your oxygen levels get compromised, and that of course creates major health risks for you. Among them, high blood pressure that's difficult to control, risk for heart attack or stroke, irregular heartbeat called arrhythmia, type 2 diabetes, glaucoma, traffic accidents, you name it. So lots and lots of negative outcomes. And when I see patients who have gone to a sleep clinic, and many of them have been told they have severe apnea, but they aren't using the CPAP machine. The CPAP is constant positive airway pressure machine. And what that machine does is it just blows air gently with enough pressure to keep that part of the anatomy open, that upper airway, so that air gets to the lungs. The lungs are happy all night. They don't keep bugging the brain. And so you get into a deeper sleep. And what this diagram shows is that across a 12-year period, people who were diagnosed with severe apnea but who did not use the CPAP machines were at higher risk for having a heart attack or stroke. And in fact, across the 12-year period, you'll see that a third of them, 1 in 3, had either a heart attack or stroke, and half of them died from those events. And you're probably wondering, well, what if they did use the CPAP machine for treatment? What happened then? Well, that's the blue line in this diagram, and you can see that the rates of having a heart attack or stroke were around 8%. So it's about 4 times the risk that you take if you've been diagnosed with sleep apnea and you do not use the treatment. So to finish up, just a few words about what you can do for yourself. So the very first thing I would do if you're struggling with your sleep pattern is to get up at the same time every day. It's called an anchor time. And if you can set that at a time that you can do for both weekdays and weekends, keep the same time, and then get sunlight in the next half hour, or go out for a short walk, or do something to get active, that will synchronize your brain with your environment in a way that's really effective. Your satisfaction with sleep will take weeks or months to get up to par, and the same with alertness, but timing your sleep so that you get to sleep earlier can be done in a number of ways. I mentioned the wind down period, taking time to relax. Some people like to listen to music, doing breathing exercises. Any of those kinds of things can be really helpful to get to sleep. Or you can use blue blocker glasses. So these are something like sunglasses that you would put on that block out the blue light, which is the trigger. It tells the brain that it's daytime. So when you put those on, you can put them on at 8 or 9 at night, and the brain now thinks it's nighttime, and it's getting the brain ready for sleep. So that can help with timing. Sleep efficiency is the amount of time that you're up in bed, awake, and alert, and sometimes that leads to a lot of frustration. I hear it all the time from people saying that I'm tossing and turning and I start thinking about the next day. So it's very frustrating. So if that's happening, it's better to get out of bed and do something that kind of calms you down. And when you're ready to go back to sleep, you can go back. And of course, aiming for 7 hours or more of sleep every single night. That's what we're looking to achieve. And with practice, you can get there as well. So with that, I've finished the material that I wanted to go over, and now if there are questions, we want to make this as interactive as possible. And I think Cindy's going to come back and join us.
Here I am.
Okay.
Awesome. You know what? I've done a lot of these sessions with you and other colleagues at Toronto Rehab, and I always pick up new tidbits. I'd never heard you talk about blue blockers before. First time I've heard that. So that's really interesting. Love it.
Good thing you came today.
I feel very fortunate to be here, for sure. So I'm going to start with my question. And so kind of as part of this, I feel like I have an advantage because I get to ask the first question.
Yeah.
But I have a Fitbit. I know a lot of people wear Fitbits now to track number of steps and cardiovascular exercise and stairs, flights of stairs. But this Fitbit also tracks sleep. And so it's not just the hours of sleep, but it actually can tell you what kind of sleep. So when you're in REM sleep. Right. So I know kind of my stats. I'm not going to tell you what they are. But my question is, REM, how many minutes a night?
So
what's ideal?
A quarter. So if you sleep 8 hours, 2 hours should be REM. 120
REM minutes. Okay.
Yeah, if you're sleeping 8 hours. Yeah. It's about a quarter, 20 to 25% of your overall sleep should be REM.
Okay, well that's...
And because most of it happens at the end of sleep, so a lot of people, especially if they've got lots of things to do and get up early to get going, they're shortchanging that REM time more than the non-REM time.
Right.
Yeah.
I don't hit 120.
That's okay.
But it's a goal, right?
It's a goal, for sure. The other thing I could say about Fitbits and such, they're getting much, much better. So they're not exactly what would be happening. You're not getting the data you would get if you went to a sleep lab and they actually wired up your brain to see what your brain was doing. But many of the newer ones now will have on a watch, they'll shine light onto your wrist, and what it detects is the pulse. So it's not just whether you're moving your hand or whether it's still, but it also detects changes in your heart rate. So that's how they detect REM sleep, because when you go into REM sleep, you get into a more active sleep and your heart rate will increase. So if your Fitbit is just an accelerometer, it's not going to have a very accurate picture of REM, but if you have the newer watches which kind of shine that LED light, they're getting pretty good. And I know all of the big players, Apple and Google, have big projects on health going on right now in order to roll out more products for people.
They are cool tools though, right? Like it may not be accurate, but it kind of gives you a sense of if you're progressing in the right direction.
Absolutely.
So, so I like my Fitbit. I'm not wearing it today, but there you go.
Okay.
Here's a question. So we've had a lot of questions. Thank you. Keep them coming in. We have a bit of time, probably 15 minutes or so. And I think we want to change the slide. We've just been asked to change the slides.
All
so
right.
that's where you put in your questions. Please email us at trf@uhn.ca. So this person, anonymous, I often wake up with headaches. Could this be connected to my sleep?
Yes. So morning headaches can be usually, depending on the age of the person, but it can be because of sleep apnea. So what happens is if your oxygen levels across the night, if your throat is closing and your oxygen levels are going down, it's putting a strain on the body and the brain. And so you are going to have problems, usually with blood pressure as well as some headaches. Some people will report a dry throat. So those are some of the things that I would check out first. So it may not be because of sleep apnea, but because sleep apnea is so important for your health and well-being, I would first of all consider that and make sure that that's not an issue. Now
I'm not sure, thank you, I'm not sure if you, I thought you were going to respond with sleep apnea. I'm not sure if you gave the stat, but if one has sleep apnea, I don't want to be dramatic or scare people, but if you have sleep apnea, the chances of having a cardiovascular incident, like a heart attack or just a heart incident, is probably 3 times greater than normal, and the likelihood of possibly having a stroke is even more than that. Kind of. So it really is important. If you think, if your partner, or, you think you might have sleep apnea, please think about getting tested. And there are lots and lots of sleep labs, not just here in Toronto, but like across the country. So sleep apnea is not a joke. It's a big deal.
And I would add to that, and I can say I actually do have sleep apnea myself. I use the CPAP, have done so for 3 years, and it makes a big difference. I do know many people who are diagnosed are not told about the health risks, and they're told you have severe apnea, and here is the machine, and then they kind of think about it and say, I don't want to be wearing a machine, not aware of what risks they're running with their heart and stroke, all of those things. So it is important for people, and as more of us get to be baby boomers, get to be 60s, 70s, and beyond, we're going to be dealing with these issues much more commonly.
And I think also we're with more science being undertaken, and I didn't mention this, but Toronto is actually the home of sleep research in the world, right? This was where sleep medicine and sleep research started back in the 70s, early 70s, I believe. And it wasn't just Toronto, it was Toronto Rehab was one of two centers that was really leading the charge. And so I think what we realized over the last 40 or 50 years is that there are so many interdependencies and connections between sleep and diet and exercise and cardiovascular disease, stroke, diabetes, that they're all connected. And so you kind of have to look at the holistic, kind of the whole person, and recognizing that if you're not eating well, it could affect your sleep, and if you're not exercising, it could be a contributor to kind of chronic health conditions as we age and get a little bit older.
Absolutely, yeah.
Okay, so melatonin. Interesting. So talk a little bit more. We have a couple questions on melatonin. Thank you for sending them in. Melatonin, they have gummy bears or gummy melatonin that you can get like pretty much any drugstore, not prescription, just come vitamin format. Benefit?
So they aren't sleeping pills. Many people who come to see me have thought of using them as a kind of a over-the-counter replacement instead of a sleeping pill, and they don't work in the same way. So, and then it depends what it is you want to do with your sleep. So, melatonin is very helpful in shifting your sleep pattern. So, if you're falling asleep too early, right, and can't make it through dinner hour and you fall asleep before your bedtime, then you probably want to have very bright light in the environment. Turn up all the lights in your home, and you certainly wouldn't take melatonin because it would tend to get you to sleep even earlier. But you might take melatonin in the morning as you wake up, or if you wake up in the middle of the night, so that it kind of extends, tells the brain we're still in a sleep mode, and it can kind of reset or shift your sleep a little bit later.
What about melatonin before bed, just right before bed?
So that would be healthy for, let's say, a teenager who is more of a night owl. So teenagers are notorious for staying up till 2 and 3.
I have 2 of them.
Oh, lucky you.
They're great. Yes.
Yeah. But the problem is, because teenagers have so much energy and the hormones, all that stuff is kind of keeping them awake. It's harder for them to stop and kind of get to sleep. And so for them, they could take melatonin as a way of shifting your sleep earlier. Personally, I would recommend blue blockers as a really effective way that they can kind of just, their brain slows down and they might be able to get to sleep earlier. And they might want to put them on after dinner sometime and just experiment with, how much or when to use the blue blockers. Melatonin itself, I wouldn't recommend to teenage girls because melatonin also has an impact on your cycles, your the ovulation cycle and all of that stuff. So if you start to take melatonin pills, they could have some impact on that.
Okay.
So I would do that only with the advice of a doctor.
Okay, so a lot of really great information, and we have more questions. I have a stack of questions here, which we're going to get to. We're going to put this information back out to everyone that's joined us here today, so that it's a lot of info coming at people. I think it's important, though, right? And so we want this at your fingertips. Again, kind of our motivation for doing these seminars is to provide some tidbits to you and us.
Right, all of us.
A little bit selfish. Really tidbits to you to help you sleep better, to live better, to be more productive in your daily lives, great relationships, and so on. So we're going to put these tidbits information back out to you after this seminar. Okay, we have a number of questions about sleep aids.
Okay.
Okay. So someone's asking about ZMA. Or if you're American, I guess that's ZMA, right?
ZMA.
Would this make a difference? Does ZMA help? Is it addictive, and is it a sleeping pill?
So, because I don't prescribe sleeping pills, and so medical doctors will. So I'm a psychologist, so I use behavioral strategies and techniques. So I'm not sure of what ZMA is, but it could be. There's a class of drugs called the I think they're benzodiazepines, and so they are often prescribed for sleep, and they can be a problem if you kind of rely on it sort of night after night, and then it becomes difficult to stop. So the American Academy of Family Practice, so that's all of the family practice docs in the US, have come out with a recommendation that any patient, any adult patient who has insomnia should first of all be tried with cognitive behavior therapy for insomnia, or CBTI, which is a behavioral strategy for changing your sleep patterns. So, and only if that isn't working, that you can then or should then think about adding a prescription to it. So prescription isn't the front line or first way of teaching or treating those kinds of problems.
We're finding, I hear this all the time because I get to hang out with physicians and neuropsychologists and scientists all the time. I'm very, very fortunate, but we're learning now that there's like a shift in healthcare, right? It's not all about, the prescription. It's about what you're eating, your diet, getting adequate levels of exercise, sleeping well, kind of developing good relationships, healthy relationships, reduction of stress.
Yeah.
And these are things that have nothing to do with pharmaceuticals.
Right.
Okay. The caveat, though, is if it's extreme, it makes sense, right? Like
Sure.
if one really is having a hard time and has tried a whole host of things, then prescription meds certainly makes sense. But to your point, let's stop it before it becomes extreme, right?
Yeah, and people come to me. So I run a practice seeing patients who've had problems with sleep their whole lives or for long periods. Many of them show up having been taking sleeping pills for 10 years. Or more some of the time. And what I tell them is keep taking what you have been doing, and when I teach you skills that help you change your sleep patterns and you can feel those working, that's when to have the conversation with the doctor about weaning yourself off those pills. So don't stop or don't try to stop until you've developed better strategies, and there are better strategies.
And so on that note, I'm not like we're having a conversation now, but so if one goes to their MD, to their general practitioner, and they're on sleep aids currently, can they actually ask that practitioner, their doctor, to prescribe them behavioral therapy? Is that something that one can have a conversation with their physician about?
Sure. I think physicians may or may not have people they can refer to who do CBT for insomnia, but increasingly there are people being trained for that in the US and Canada, and there are many people that are well trained and can provide that treatment.
You know what? Times are a-changing. This is good. This is really great.
Yeah.
Okay, here's a question. I'm guilty of this. Are naps during, I don't know if it's guilt, if it's a good thing, are naps during the day a good idea, or is catching up on sleep during the weekend a good idea?
I would say yes. As far as your health goes, it's actually Positive. There's studies done in Europe where, siestas are fairly common, and they've looked at people who are regular nappers versus hardly ever nap, and the ones that are regular nappers are less prone to have heart attacks and other health issues. So, and of course back in the 90s they talked about the power nap for executives where you close the door and just put your head down for 10 minutes. And I would say if you need to, absolutely, napping is not bad for your health.
Okay, great. I'll keep doing it then when
Good.
I have time on a Sunday afternoon.
Right.
So we have a question from one of our colleagues actually at Toronto Rehab. So we have all of our 5 sites. Toronto Rehab has 5 sites across the city of Toronto. This comes from our University Centre on University Avenue. Could you talk about the role of sleep to promote healing? And in brackets we have pathophysiology.
Okay. So I think they're talking about what the body is doing. So I alluded to that earlier when I said about 90 minutes into your sleep, the body releases growth hormone. So that is then going around to encourage cells in the body to fix themselves. In addition to that, there are other physiological changes. For example, in the bloodstream, there's much more magnesium that is released. And magnesium basically tells nerve cells to kind of quiet down and muscle cells to relax. So there's numerous physiological changes in the body that are happening, and they all support rest and restoration of functionality for the daytime.
That's great.
Yeah.
Another question from our Toronto Rehab colleagues. They're
out there,
watching.
eh?
Okay,
Thank you
this
for
is
watching.
great. So how does an acquired brain injury affect your sleep cycle? I'm going to do an add-on to that one. So I understand for stroke patients, post-stroke, when they're in hospital or just kind of on their way home,
Right.
that often they'll go on CPAP machines and that
Right.
actually might promote healing. So can you talk a little bit about that?
Yeah, so that's a really, really good question. Any injury to the brain itself is going to cause the brain to release all kinds of other immunological substances, things that are meant to kind of help the brain heal. And after stroke and mild TBI, you have basically the brain trying to recover, trying to rebuild its ability to function. So it depends on how serious the concussion or mild TBI was, but it can take some people weeks or months, or it might end up in a post-concussive syndrome, which is particularly difficult to treat and a whole animal to itself.
Okay. So here's an interesting one, and you kind of touched on it already, but it's a yoga-related question. I know we have a number of people that practice yoga actually physically in the room with us here today. Yoga, meditation, relaxation exercises close to bedtime.
Yeah.
Well,
highly recommended. It is something that will help the body and the brain to relax and calm down. And there are certain yoga postures that are conducive to getting ready for sleep. So for those that do those things, I would encourage them to do them, especially before they go to bed in the wind down period.
You know what, I love your outlook on kind of health, and you know that it really isn't all about the medications, that it is about your kind of outlook, your exercise, all those great things that make up the whole person. A very, very holistic approach, and I think medicine just generally is moving in that direction, which is very exciting to kind of see and be part of it. So
I think we're living in exciting times.
we definitely are. Okay, so there was another question about a sleep aid. Let me just see here. I apologize, I lost it. Oh, here we go. Zopiclone. Are you familiar with Zopiclone?
Yeah, Zopiclone is the most prescribed sleep medicine in the US and Canada. Yeah. And it doesn't create normal sleep. That's an important idea. It just slows down your nervous system so that you kind of get knocked out, but it does not create normal sleep patterns. So it's used because people are desperate, but as I said, using CBTI or other behavioral approaches is much preferred.
Okay. Commentary, we're almost done. I think I'm going to take the next question, the last question. Caffeine. Can you talk a little bit about caffeine and the impact, on sleep and other aspects of, our
Sure.
day-to-day?
So caffeine is, for most people, if you drink a lot of caffeine in the day, it will make it harder for you to get to sleep at night. But there are individual differences and there's dosing issues too. So for some people, they're very hypersensitive to it. There's no quick answer to caffeine and sleep. My mother-in-law used to be able to drink a coffee and then go to sleep at night, no problem. So
Right.
there are.
We had a question about wine before bedtime too, but I didn't ask it. I kind of just, anyway.
Yeah.
So yes, for sure, caffeine, it's a longer, trickier response than what we have time for.
Okay.
So I think we're pretty much out of time with respect to our questions. Thank
Okay.
you, Jaan.
Thank
Always
you, and thank you for the audience for
privilege
sticking
to have
around.
have you share kind of your knowledge that you've acquired over a very long time, and really it's thanks to individuals like you and our colleagues right across the healthcare system that we're able to really enjoy a wonderful life here in Toronto, and for the most part our community is very, very healthy. Again, our focus right now is on prevention. Our health innovation seminars will be focused again on giving you tidbits that you can take personally or share with your colleagues, your friends, your family, and so on, to make you think. And if we can make you shift one or two things through these sessions, I think we've done a good job, right?
I agree.
We've done a good job.
Yeah.
Okay, I do want to promote something before we let everyone go and enjoy the rest of their day. We have a big event coming up, Nathan Phillips Square on Saturday, October 13th. Toronto Rehab Foundation takes over Nathan Phillips Square. We did this event last year. We set a Guinness World Record. We're going to do even better this year. So it's coming up. We would love to have you come out and be there and support us, or actually spin. It's a spin-a-thon, a static cycling event. Lots of music, great fun. And quite frankly, we're raising money for an awesome cause to kind of do things like we are doing here today. So I think that's it. I did want to acknowledge a couple of colleagues for helping put this session together, namely Arlene Boyce, Henry Zajac, and Andres Escobar for their hard work doing these sessions, organizing them, getting the information out to you, securing our sponsors, working with our sponsors, and just being the most awesome colleagues. So on that note, we'll be back to you with another health innovation seminar. Watch for this being uploaded on YouTube. We'll let you know about it, and have the most loveliest of days.